I just want to thank everybody for coming. Parents, presenters. Like Dr. Udell said, hopefully this is the first of many. We are all very, very important here. We are all a piece of the puzzle. And that's what everybody needs to remember. ABA is crucial. Diet is very important. Speech, OT, all of these things are very important. And one thing I want to say about the ABA, it needs to be integrated into the home. It's very important. Okay, you can't just do ABA, you know, a couple hours a week at your ABA center, go home, and not reinforce it at the home. Now, what I do here is hyperbaric oxygen therapy. That incorporates everything. That makes all of these other modalities just work better, faster and better. Well, this is just a little bit about me. I've been in the healthcare for over 30 years. Most of my experience has been with adults when I started in the cardiovascular, working with heart surgeons, open heart surgery. When I worked at Florida Medical Center, I was asked to start a hyperbaric unit there. They hired me for a few different reasons. I went back for training, and I worked with wound patients, but yet I was always getting phone calls from parents and adults. My husband had a stroke, my child has cerebral palsy, blah, 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 can you help me? I couldn't help these people, and I felt like my hands were tied, because if you think about the science behind hyperbaric, you think, of course it's going to work, but yet the hospital would only let me treat wound patients, and so there was a need for this. And so my husband and I decided, hey, we could do this better, and so we did. What is hyperbaric oxygen? Hyperbaric oxygen is oxygen under pressure. The FDA says it's 100% oxygen under pressure. We utilize these chambers here. They kind of look scary, but really, if you see the kids in these chambers, it's the funniest thing. I had a little boy who started 2 weeks ago. Before he even started, his mother came in for a tour, and she says, oh, I don't know if he's ever going to go in there. He wasn't even on the schedule. He jumped up on the bed and started like trying to push himself in. They can't get into these chambers fast enough. I think, and some of the moms here who I've treated, they will attest to the fact that the mom is usually more nervous than the child. There's certainly more crying from the mother than the child. Okay, how does it work? Well, we know that these children have certain areas of the brain that are lacking in oxygen or metabolism. They're just not getting enough perfusion in certain areas of the brain. And these areas of the brain, that's the areas of the brain that control their socialization, their speech, their behavior. So what we're doing is putting that oxygen in the brain. And because they're under pressure, they're actually getting new circuits in their brain as well. So they're getting the oxygen and they're getting the pressure. Now, what they have in their brain is similar to like a wound. And we already know, it's been a proven fact, that hyperbaric oxygen helps wounds. That's why they do it in the hospital. Well, what these kids have is basically it's a wound in their brain. They also have a wound in their gut. We know that. So the oxygen also helps heal with their gut. We know that it kills the yeast. The yeast can't grow in an elevated oxygen environment. So any type of the dysbiosis and the bowel inflammation all gets fixed. You know, it just heals from the oxygen. There is a test called the PET scan, and it does evaluate the blood flow in the brain. And so we do know that most of these kids, or all these kids, have decreased blood flow to those areas. And at the end, I have some pictures of SPECT scan, and it'll show you the hypoperfusion before the treatment and then after the treatment. Well, I go in there myself And I'm 80 years old. No, I'm kidding. It's very, very relaxing. When the child or adult, anybody goes in there, we put on their favorite movie for them. We have a whole library of videos. And it's very comfortable. The only thing that they feel are their ears popping the first couple of minutes that they're in the chamber. These kids know how to clear their ears. It's so amazing how they clear their ears. They swallow. Whatever they do, they know what to do, and they clear their ears. And then they just play in there. So it's very comfortable. The temperature is about the same. And I've been doing this a long time, and rarely do we ever have a problem getting a child in. And if we do, it's the first or second treatment, and then we never have a problem getting them in again. Many of the children that we get are nonverbal. And because I think the parents are constantly, we're going to the chamber today, we're going to the chamber today, we're going to the chamber today, you know, whatever. Sometimes that's their first word, is chamber. Any negative side effects? Really? No. Even if your child has seizures, that's one of the indications for hyperbaric is seizures. So there really are very, very few. The only thing are the ears, but we check the ears before they go in and when they come out. So really no side effects. We ask that they wear 100% cotton clothing. We want to decrease any chance of any type of accident. So you go in there with 100% cotton clothing, no oils on their body. They cannot go in with toys, but they can go in with a water bottle. As far as colds go, if they're very, very congested, we don't usually recommend it. Now, usually we can tell that they're getting a cold before you can tell. Because as we're putting the pressure on, they will start to do this or pull. We go very, very slowly with these children. Normally, the normal person that would be scuba diving, because this is like scuba diving. So the normal person that would scuba dive to 17 feet, which is usually what we take them to, would take 30 seconds. But it takes us about 10 minutes to get them to pressure. We take them really, really slow because we don't want to hurt their ears. But if they start tugging at the ears, we always know that they're getting a cold before the parent does. And we'll tell them, your son's getting a cold, your daughter's getting a cold. No, he's fine. I'm telling you, he's getting a cold. And 2 days later, he has a cold. I just want to briefly go over this. There are different types of chambers. There's the heart chamber. There's something called a multi-place chamber, which I'll show you pictures of in a few minutes, where it's a big room. Now, these chambers are pressurized with medical grade 100% oxygen. The multi-place looks like a big room and everybody marches in at the same time. It's pressurized with air, and the patient or the child has to wear either a hood or this big mask. Now, there's a couple of downsides with that. First of all, most autistic children are not going to wear that hood or the mask. Second of all, you all have to be at the same protocol, meaning you all have to be at the same pressure, you all have to get there at the same time. If one of you is sick, you're all going to get sick. It's a little inconvenient where children are concerned. And then there's something called a mild chamber, which I'll show you pictures of. Now, the mild chamber, this is a hyperbaric oxygen chamber. And I stress oxygen because it's run with oxygen. The mild chamber is not pressurized with oxygen. It's pressurized by an air compressor, and sometimes the parent will entrain a little bit of oxygen into it. They weren't designed for this type of therapy. They were actually designed for altitude sickness. And many parents put them in their home, and I think that's great if that's all they can afford or if that's what they were told to do. The problem is, and I've been to many hyperbaric conventions, and one of the leading hyperbaric physicians at the University of Louisiana states it this way. He said, you will get a result, But it's like riding your bicycle to the end instead of riding, a jet engine to the result. Are you going to get there? You may get there, but it's going to take you a long time to get there. When you're talking about a child, you don't have a lot of time. You don't have 30 years to fix them. So will the mild work? Some parents say it does. I get a lot of calls that say, well, I've had the mild chamber for a year and I haven't seen any change. Well, then why do you continue to do it? If you're going to spend $15,000 on a mild chamber, don't. Spend it in something that, that maybe will work, because you're going to be, in the long run, spending less money. As far as insurance goes, we have been very lucky to get insurance reimbursement. Right now, we're involved with the University of Louisiana and the Department of Defense and the VA, and we're treating veterans. And we want to show the government that these veterans that are coming back with brain injury and post-traumatic stress disorder, which is also a brain injury, are getting healed. We're able to fix these guys. We're saving the government billions of dollars in pharmaceuticals because we're helping these guys get back to life, not only front line again, but back to life. Once this study is done in about another 18 months, they will see how effective this treatment is. We want to show the government and the insurance companies that this treatment works. When this study is done, the next study that's being petitioned, that we're already signed up for, is autistic children, which probably will not take as long, because once we have this first study already done and we show that brain injury can be, fixed with other modalities, not just pharmaceuticals, then brain injury and neurological disorders like autism will also be covered by more insurance. But these are the type of chambers that they will be using for that study as well. Now this is a picture of what a SPECT scan looks like. And if you look at a SPECT scan, oxygen's not getting there, perfusion's not getting there, metabolism is not getting there. So you can actually see that it's actually doing something. Now the standard protocols for this, again, and this was set up not only by the hyperbaric physicians, but it was at the autism conference in 2004, is 1.5, 100% oxygen. And this is a picture of the different types of chambers. The ones on the top are the multiplace, and as you can see, I don't know too many children that would want to put anything like that. Forget about children. I wouldn't want to put it on my face. And then on the bottom you have the mild chamber. Once you get the pathways completed again and you get oxygen in your brain, you never go backwards. You only continue forward. We've had, children that have, let's say, had a couple of months worth of treatments, and then they've stopped. You will still see progression in their development for a good 30 days. Because it is a costly therapy, we usually tell the parents to start with 20 treatments, but they never stop at 20 treatments, because you see a change, and you see a good change, and you don't want to stop. So they'll continue.